Everybody ready? I think we'll get started straight away. And Ben, I think we will start with you, if that's okay. So Ben, you've had an illustrious 24-year career across the finance and healthcare sector and multinational companies. Can you tell us a little bit about what you think are the specific challenges for change management in hospitals?
Thank you, Emeline. Sorry, can you increase the monitor in here from her mic? Okay, let me start. So first and foremost, I think how to deliver a very good change management process. I mentioned it yesterday when I was speaking about cybersecurity. It's actually the leadership support, right? You need to obtain the management support for you to continue the overall process, because it's not only like a single task, it's a multitude of tasks, it's a very comprehensive approach, and in everything that you are going to do, you need to have their support, right? Whether it is the budget or is it the clinical support or anything, right? In our case, yeah, we have a very good management team. Yeah, I have one of my CEO here, Dr. Susan. Yeah, so she's been very supportive to us, where every time when we make the changes, yeah, they are the one who's actually would like to have the mindset of the standardization, all the changes has to be the same, and looking forward not only for temporary solution.
Okay, thanks, Benedict. Nacho, if we could move on to you next. You had a similarly extensive career, this time in IT operations within a single hospital, right? And I think you've probably got one of the most interesting job titles in the whole of the summit, Chief Process Innovation Officer.
Bit of a mouthful, yeah.
Can you tell us what your specific responsibilities are in terms of, digital transformation and change management within your organization?
Sure. I was the CIO of Bumrungrad Hospital for 5 years. That normally it's enough in the CIO position. Either you're fired or you have a heart attack. So the organization saw the need of focusing on re-implementing the systems and innovating. Innovation for me personally is different of what Tracker and InterSystems explained to us. We're very lucky to have partners that can do ideation. In the hospital, we don't have that mentality of ideation. We're there to solve the problem, right? So innovation for us stems from the problem. So we need to have an innovation process that we can repeat and reuse, and a team that can be on-site solving problems in a better way, with the aim of improving operational efficiency and patient safety, right? So in that sense, you have the exercise to rethink every system from scratch and think, can we do this better? Which we can and we must. Mm-hmm. So that's the role.
Excellent. That sounds really exciting. You were talking the other day about an innovation register within Bumrungrad. Do you want to tell us a little bit about that?
Oh, I see. So, again, there's two camps looking at innovation, and there's papers published about it, right? They call it exploration or ideation, right? Or exploitation, right? Exploitation means when the innovation stems from the problem solving, right? We have a problem and we need to solve it. Many times you have seen a solution looking for a problem, blockchain, right? I mean, still have to see blockchain, which is a great technology, solving something more efficiently in healthcare, right? AI could be something like that. When we get people in the hospital in the room and say, what can we do with AI? It never gets anywhere, right? Digital printing. I remember once, they put us in the room and said, with a digital printer, and said, what do you want to do with it? I said, well, we didn't come with a prostate of a femur, I printed a little ring that I wouldn't pay money to buy, right? So we need to have an innovation process first. That is problem, solution, implementation, and not the other way around. And for that, you need an innovation registry. Like John was explaining, and Paul, they had 124 teams with ideas, right? Well, I'm sure that of all those ideas, you can put them in a registry and prioritize them because all of them stem from a problem that you have to solve, right? So you create an innovation registry, you own that registry and the process to solve those problems effectively during a period of time, continuing the program.
Okay, interesting. We look forward to seeing how you innovate at Bumrungrad in the future, partnering with InterSystems.
Yeah, may happen, may not happen. You know, I don't know.
Dr. Gracia, we'll move on to you now.
Yes.
You've got a similarly interesting background. I know that you have a clinical background as a general practitioner.
Correct.
But you've also been head of quality and risk and
Yeah.
patient safety.
Yes.
Tell us how you think your specific background has influenced the way you run change management at the S.Kom Hospital Group.
Thank you, Emeline. I would say that my clinical background as a general practitioner and also quality and patient safety has profoundly influenced my approach in the EMR change management in S.Kom Hospital Group as a whole. Understanding the daily challenges that are faced by the clinicians, the nurses, other healthcare professional in our hospital allows me to design and tailored specific in the track care system that is tending to their need. So with that in mind, I conveyed that message or that concern to our great team. Padeni's here and also the IT team for support. We conveyed that message throughout the team, and then and hence after that, our holistic approach to the change management and the EMR system in our hospital group has become more efficient, user-friendly EMR, and that kind of way. I think that helps us a lot. Thank you.
And do you think your background as a medical doctor, made you more successful with the medical and the nursing team at
Yes,
S.Kom?
yes, because I know which current flow that is suitable for. For example, we have a very big issue about patient discharge, but getting my clinician cap, getting my nurses cap, and having a multidisciplinary team, it helps us to understand what are the key or pain points that are happening inside our hospital and inside S.Kom Hospital that we need to tweak. What is the patient journey? Okay, for example, a patient comes to, let's say the patient is planned for discharge tomorrow. How is the medical discharge going to be like? The medical discharge, the doctor will have the medical discharge, and then afterwards, what are the pharmacists need to do? They need to return the drugs. They need to prepare the drugs for going home. What about the labs? What about the procedures that has been in place for this patient? So that, putting that in mind as a team, a collaboratively team, we designed the flow of patient journey inside to cater the patient needs.
Okay, excellent. Thank you. Thanks
Thank
for
you.
that, Dr. Gracia. Ben, we'll come back to you. You have a group of 3 Ramsey hospitals, over 600 beds, all have JCI accreditation. And you've managed to consolidate all the workflows into a single instance of track care. Now, I know we've got some customers in the audience who are very early on in that journey. So tell us how you did that. Tell us how you persuaded those 3 hospitals to adopt a single workflow into a standardized database.
Yeah, it's not easy because you need to find, how I say, the standard one that you would like to implement. And in our case, what we did, again, we talked to the management first, right, on how to do this. So we established the list of super users for each of the hospitals. So we have the medical team from each of the hospitals who are the leads, and also nursing, labs, all those related business units, right? And we put them all together. We make them all to discuss what will be the standards that we will going to deploy. Yeah, it's not saying that one is better than the other one. Yeah, because again, all of them are JCI accredited, and all of them are CARS accredited as well. It's just selecting the one that you would like to use, right? And it's not easy because definitely people would like to have, oh, I'm used to this method, I'm used to this approach, I want this one. Now in our previous track here, because it's a separate instance in each of the hospital, you can do that. But now with the standard one, you cannot do it, right? So That's what we said to them, even from the very beginning. So each of the hospital contributed to those peoples, even from the beginning. So they have the discussion, they have the quarrel, in my opinion, yeah. And at the end, yeah, they have to make the decisions. And if, say, that the decision cannot be made, then we escalate it to the management. Let the CEO make the decision. And all of them definitely have strong background. Yeah, each of them has its own specialties, so they can contribute also. So by making them all together to contribute on these phases, at the end of the day, we can reach to that to that one voice. Yeah, like I say, even up to now, when we make the enhancement or the changes, now we already mentioned, okay, you need to discuss it with the 3 hospitals first before you can make the changes. Yeah, it's not easy, but that's the way that we need to do.
Okay, can I ask you a follow-up on that? Can you remember a specifically challenging issue where you had a group of representatives from each hospital and they really couldn't agree? What was that specific one that had to be escalated to the management?
Even one decision to use a specific form in the ICU. Yeah, even at one point, the super user from the other hospital and the other hospital, they have a fight. Yeah. And then in certain times, yeah, they're not talking to each other anymore. Yeah, but at the end, after it's been decided, yeah, everyone needs to follow. Yeah. I have some of the super users also over here, so they also know about it. Yeah,
that's interesting. Interesting. Yeah. Okay. Ignacio, we'll come back to you if you don't mind. Your organization is about to undergo another transformation, moving on to the latest version of track care, which will give you greater depth and breadth of not only clinical but admin functionality. How do you plan on leading this transition to the new platform?
Sure. Hello. Step by step, I think is the last time. That was the answer. It's a big change for the organization. And there's projects within the project. So when you bring something like an MUI standard, where everybody is involved, including physicians, the change is massive for the hospitals. And we're going to have that encounter record implementation. Encounter record means electronic physician documentation. And that is not a project, that is a program that stays over 5 years, over 10 years, always improving the way we document an encounter, right? So that is a huge change for us. We traditionally wanted to adopt trackers software and ingest software as fast as possible, and we are kind of on the latest versions, but it's very traumatic for the hospital to upgrade. It takes a long time of testing, and it takes a long time of training. And I think that we need to change the way we think about it with the help of InterSystems. We have a large group of super users, but they are not super users. They don't fly, they don't have X-ray vision. They are super testers mostly at the moment. No, they know very well the area, but they test. And we spent a cycle of 3 months, about 400 FTs of testing each upgrade, right? That makes us slow, and also makes our super users focus on testing, not actually in being the subject matter experts that can document how to operate the hospital through the HIS.
They're the best, actually. Yeah. I mean, in their own businesses,
right.
Even IT. I mean, we don't know. I mean, as best as their knowledge, right?
Mm-hmm. So we have an approach to start thinking about automated testing. Documented the standard and documenting every deviation of the standard and trying to justify it. I'm sure that I'm going to go through the same quarrels that you were describing, and making decisions based on problems. So what I would like to see is what problems does MUI solve to the hospital? And what is the success criteria when we implement any deliverable for MUI, right? So the decision is not to go live. The goal is not to go live. The goal is to solve problems of the hospital using MUI.
Okay, perfect. Thank you. So there's a lot of talk about subject matter experts and super users. And Dr. Gracia, if I can come to you, you've got a group of hospitals that you need to get
Yes.
live with Track, and you've done two already.
Two already.
And you're going to be on your third one in November.
Yes.
Yep.
Mhm.
So if you don't mind sharing with us in terms of clinical user engagement specifically and change management within the clinical staff, would you mind sharing with us what you found was a successful way to do it, and what do you think you would change with the other hospitals that you want to go live with Track?
Thank you, Emeline. So currently we have 7 hospitals throughout Indonesia. And the first one to implement track care is in our flagship hospital, which is in BSD. Happened in March 2024. And following to that is recently our hospital in Cibubur area. 4th of August, we just implemented. And their fee takeaway points that we were studying based on our BSD implementation. And the successful stories from BSD implementation is, first of all, I would highlight engagement with the clinicians from the very get-go. So once the top management actually decide, okay, we're going to go through track care, then our team could, we need to look on what are track care is what are we getting from track care, and how does it help our clinicians and other health professions to get the best out of it. So we studied it, and then we engaged with the clinicians. Doc, this time, last time with the current EMR, you can't do the timeline view. This one you can. There's no balance, liquid, balance, cairan apa? Cairan balance itu nggak ada. But in track care we have. So these are the features that we engage with the clinicians from the get-go. So we get there, yes, I'm going to use track care. So that's very pivotal for us. The second of all is having a multidisciplinary team, like I mentioned earlier, that consists of physicians, IT specialists, nurses, and other health professionals to collaboratively design the best possible ways of solution for our needs. So that is pivotal, like Ben was mentioning earlier. And then also stakeholders. Stakeholders from owner to our group CEO to our chief and directors, they were told to get on it. Get on it. Because when they are engaged, when they're on it, then everything will just follow. I think that is the most successful story that Eka Hospital in particular we implemented. But we also faced some difficulties, Emeline. Yes, of course, the transition in BSD was not as smooth as we expected, but we learned from it. So the thing that we changed immediately when implementing to Cibubur was actually we spent more time on the training sessions. The training sessions with our clinicians and also our super users, because we found out that when we did a one-on-one training sessions with the super users and our clinicians, that is very effective rather than having a group training. So, but the pitfall on BSD is that we have a short amount of time for the training session, only about 1 month before go live. So yeah, there was a bit of a rush. And hence we took that into consideration, and then we said, oh, we need more time. How many months do we need to prepare them? Okay, roughly about 2 months. So our super users from the corporate level, they train the key users from Cibubur, and they actually rehearse it more and more so that the clinicians and other health professions are more comfortable using the new system, because that and it worked very effectively. And then the second of all that we learned is because our hospital is a group hospital and one clinicians can actually work in another hospital. So because they were in BSD first, they know all the challenges. Okay, I can't do this, I need to do this, and so on. So they learn from what happened in BSD. And then when we implemented to Cibubur, they actually become the super users themselves, the specialists. We have anesthesiologists, we have internal medicine specialists, and they were the ones that pioneered the change in Cibubur. So actually, to get them engaged for the change that is going to happen, so that was proven to be effective. And then the last thing that we changed is feedback. So a constant, frequent check-ins for feedbacks. We did that every single day before go live and after go live to see if whether or not we can make some changes, because there are some current flows that we need to tweak. But yeah, that works very best. And I think because of that, because we have a great team from the corporate and also from the other hospitals, we successfully Cibubur implementation of Tracker went very smooth. That's to be honest, and we're gonna continue to roll out the same practice that we did in BSD and Cibubur to other hospitals. We're going to go live on November for the third hospital in Bekasi, and simultaneously for another new hospital of ours in Depok, which is currently being built.
And when would that last go live be?
That would be in December for Depok.
Wow.
So yeah,
four
it's
hospitals in a
yes,
year.
correct.
Amazing. So from Ben, we got this idea of put all the stakeholders in the room together and kind of let them fight it out. So that you generate buy-in from the users. Nacho will do things step by step to make sure that that the users can cope with change. And from Dr. Gracia, it's all about emphasizing the benefits. What
Yes.
will they get when we go live?
Correct.
Emphasizing those benefits, and it sounds like you communicate those benefits quite well with your end users. And this idea of frequent check-ins, lots of comms, and in some ways working on optimizing the system specifically for them. So that's sounds really good. I mean, in the last couple of days, you saw a lot of presentations around artificial intelligence, which is another transformational change, I think, that's coming up, not just in healthcare, but everywhere. This is a question for all three of you. What problem are you looking forward to solving with AI? And how do you think that will drive change within your organization?
Ben, you first.
Okay. Well, first and foremost, are we ready for AI, right? You look at AI as a threat or something that could bring you more values, right? That needs to be acceptable to all people, right? Whether it's a clinician or the management, everyone else, yeah, all have to have the same mindset. In my opinion, AI is going to complementing the way we are working, right? But if you are abusing it, that can be a bad experience for us, right? If it's too much, also that's going to cause us problem. So we need to have that same understanding first in the beginning. And then how you're going to put it into the system. For instance, you can see already yesterday presentation by Dimitri, actually some of the activities that we are longing for to speed up the process, to ease the process for the clinicians can be done with AI. But is it safe? Do we want that? All of them need to test it and have a look at it and look for the potential risk. Yeah. If the risk is okay, it's acceptable, then we should go for it. Yeah. Even up to now, right? I was talking to some of my colleagues from in the other hospital. Some of their doctors already trying to put their diagnose in the open AI or Microsoft Copilot before they're putting it into the SOAP. Why? They try to rewrite it based on, okay, it's a good grammar, it's good vocabulary. Before, maybe they only write or type really easy, quite simple, right? Now with AI, they can be supported. So even they're already considering that, and they still doing it manually. So they type it first in their handphone, right? And then they have a look at it. Okay, so they retype it again. So they have already the same mindset, but these are mostly younger doctors, not senior doctors. Yeah, but again, this must be acceptable at all levels and all positions. And in my opinion, yeah, we need to embrace the changes, adjust ourselves, and it will going to change the way we work again, right? Just like maybe our hospitals recently, I mean, me and Dr. Gracia, we upgraded ourselves to a new trachea. Dr. Gracia has a different system before. In our case, we have an older trachea, 2011 version. From 2011 to 2023 is a huge gap, right? A huge technology gap. And even from when we told them that, okay, we need to change. Now, whatever that you would like to do in the previous version, you can no longer use it in the new trachea. It's different. The new one, I mean, it doesn't say that it can easily be customized, but there are certain limitations which one you can customize and which one you cannot, right? But in the older trachea, basically you can change everything, right? But we still want like this to remain the same. No, you cannot. So you need to accept to that level as well. Now, with AI coming in, definitely your way of work is going to change. You need to adjust and be ready. I mean, it's not going to be like tomorrow, right? The changes. You need to embrace it maybe like a year from now. But at least the message is already there. By looking at the technology, we can see, oh, how will this impact our operations? Like yesterday, oh, when you have the tracker assistance on the top as a search button, right? Now we should train our doctors how to do the searching rather than how to do the clicking, right? You need to change the way you are doing the training. If we are using the AI just like yesterday, we need to mention it. Oh, you need to talk slowly. You need to mention all the information. What are the information you need to state? You need to teach them because you are not clicking anymore, right? If you are forgetting something to speak about it, then it will not going to be there. So you need to add it manually, right? At the end of the day, it cannot just predict all of a sudden, oh, it appears. Of course, it cannot be like that, right?
How about you, Ignacio? What problem are you most what problem are you most looking forward to solving with AI, and how do you think that will drive change within Bumrungrad?
Well, I mean, again, I don't want this to be a solution looking for a problem, right? So when we look at AI is here to stay. Having an AI governance in the organization is really important. But I look at it from, for example, is it everyday AI or is really cutting edge AI for the doctor? Is it patient fronting or is it internal? And then we make different decisions. For example, I hope that I don't have to write a job description ever again in my life from scratch, you know? So I see that there is problems that we have that can be easily helped by using AI, you know, so you don't start with a blank sheet of paper, right? Now, if I'm gonna go into improving patient safety, you know, and I have to implement, you know, a structured physician documentation with the aid of AI, I really want to solve that problem, but it's gonna take me a much longer time. I'm gonna have to think about it. By the way, I thought the presentation was brilliant, and I think that it's going in the right direction, where we are presenting our doctors with something that not only saves them time, but improves the quality of the note, and at the same time makes them validated. So we still have our patient safety measurements in place. But I think that in a hospital we have many challenges. There is a contact center, right? There is talking to the patient so they can come to the hospital, chatbots, etc. And that those we all have those problems, and the measurements are always to improve the efficiency and to improve the patient of that safety. So I'm looking forward to also improve the conversation that we have with our patients with the help of AI, helping an agent, you know, to have a meaningful discussion with a patient. And that is not necessarily a patient talking to a bot, right? Is a patient talking to somebody that can augment their knowledge and responds better and faster to their needs. So I would really like to be involved in solving those problems as well, right? But I don't want to write a job description ever again if I can help it.
Dr. Gracia.
Okay, adding to that, I am very excited about the AI opportunities. Ben said, yeah, we have to weigh the cons and the pros. I agree. But I am very excited to what AI can offer because it's basically bridging a gap between manual to digital. AI is in the middle, I think, and there are many opportunities that AI can help. As an example, I am very keen of is basically having a clinical decision support system. I mentioned to you yesterday, right, Emeline? That is a very significant tool that if it's embedded in the system, whatever the system, in this case, we're talking about track care, I think it will help the clinicians to improve the patient diagnosis faster, getting a differential diagnosis, because sometimes when we look to a patient, for example, a patient comes to the emergency department with a epigastric pain, do we consider this for dyspepsia or gastric problems, or do we need to reconsider this as a heart problem? Because sometimes even the GPs, they are having this kind of difficulty, Emeline. And then with using that, the clinical decision support system, and having the algorithm embedded to the system, that will help the clinicians, in this case GP, as I mentioned, they can help diagnose patient faster. They can have many differential diagnoses. Okay, the patient is not presenting with this symptoms, and if the lab results or the radiology results is not according to gastric problems, then what other problems that I need to consider? I think AI is one of the solutions that we need to emphasize more on, because nowadays there are many products selling about AI and digital. For example, mammogram detecting breast cancer or lung cancer. There's so many of them, but there's so little that is embedded for the clinician decision support system. And if possible, Dimitri and your team, if we can have it in track care, that would be very game. It's a game changer for all. That's from a clinician perspective. But also because I'm a hospital administrator, I want to streamline the whole administrative task. Like you mentioned earlier, everything is manual, paper-based. If not paper-based, okay, we're moving to digital. But I have to key in, like Dr. Bella yesterday mentioned earlier in the demo. I have to click, so many clicks, so many typings. There's so many typos and stuff. But how to bridge those gaps? So those streamlined administrative tasks for clinical documentation, I'm very excited for the voice to text summary. Hopefully can be implemented very fast. So we as a user can really adopt it. I'm very keen to that. But also not only that, I want to have a employee productivity, for example, measurement using AI. I know some of the softwares that is marketed. They said they can do that, but we want to measure that as well. Perhaps automation from patient appointment or in reminders. That's also one of the things that I'm very excited for AI.
Excellent. It could well be that the cohort of doctors I talk to are mostly in healthcare IT, but I'll have to say, you have somebody like Benedict, and the first things out of your mouth about AI is risk and managing risk and risk aversion. Nacho, not quite sure. We need to find a good use case, but I'll have to say the majority of the medical professionals I speak to, they're like, no, we want AI now.
Yeah.
We want AI now.
Correct.
We want it to help me diagnose. We want it to help me fill in forms.
Yes.
I want decision support. I want AI to not quite tell me what to do, but kind of guide me in what I need to do next. And it's mostly the medical staff who want that, but the ID team tend to be a little bit more risk averse and risk shy, which is
realistic.
Very interesting.
Realistic, maybe.
Yeah, in everything, I think you need to be really cautious, right? It's not like that you have a new technology, let's deploy it tomorrow or next week. Obviously, you can't do it, right? You need to see whether there are dependencies, other systems, right? So, yes, we know Gracia is one user, definitely, right? All users would like everything to be quick. Okay, I want it next week, right? People always like, but we need always to be monitoring all actions, right? And how we are predicting the cases. How is it going to? This one is not okay. So even in the healthcare, we have the QMR, right? Quality management and the risk, right, to handle it. So basically, it's the same. Now, when we have a new technology, those things still need to be assessed. Yeah, and I believe it's not going to be that long. I mean, for AI, because say, for instance, the key for AI is data modeling. So if you have like 10,000 cases, out of that 10,000 cases, right, you get the equilibrium. Okay, this is the decision, right? So then you can get the better assurance level. Okay, this will be the key, right? This will be the answer. So on that one as well, the clinician can also be quite supportive. They can have better assurance as well. Yeah, if they have to make the clinical decision support system, just like what Dr. Gracia mentioned. Otherwise, they could ask the questions, right? Hey, where is this data coming from? Is this correct or not? People can question those things, right? But there are also people who can be quite skeptical. Okay, I just follow everything. There could be other people like that. But again, AI is coming, so we have to just embrace it. Yeah. Whether it is manual or for clinical, everything can be conducted like that. Even for, I mean, you're mentioning about the predictions. For instance, you would like to employ how many people in the administrative roles, how many farmers that you need, when is the best time, right, to have the most people, like for instance in the pharmacy, right, where you have the most prescription as well. You can do all those calculations. Yeah. And I believe even with the current tracker, we can already do that. Yeah, but we only still have to do it manually, right? We need to pull out the reports, we put it in BI, and then we analyze it by ourselves. But now with AI, you pull the report, you paste it, or you upload the file into Copilot or OpenAI, then you can put the questions, right? Who are the most, let's say, for instance, there's a marketing report. What's the top 5 payer, right? What the differences compared to last year and everything? They will create everything, all the reports by yourselves, without for you to identifying it yourself. Right? It's helping you.
What do you think about that thought, Dr. Gracia?
I agree to that. And adding to that is actually one of the key issues that we have in our current Indonesian government is that there is no policy about AI. I don't know about other countries. Do you have the policies regarding AI and how that constrains to the capability of AI in the future run? Because I would like to speak to our government. Please help. Pak Setioaji was here yesterday from the digital office. I would like to help have him and his team to regulate some kind of regulations about AI because it's not here yet, right? So we don't know to how extensive AIs could be. It can be dangerous, like you said, and so on. But we do need to have that kind of regulation in place because we don't have it right now.
Yeah, ethical AI.
Yeah.
Ethical AI. I mean, there
Agree.
should be like a certain policy to govern those things.
Yeah.
Thoughts on this, Nacho?
But we want it now. Right?
Agree.
This is, I mean, it reminds me of Photoshop. You know, you remember when if you were in marketing or something like that with technology, somebody would come with a crap picture and say, "Can you Photoshop it and make it good?" It's like, no, I can't. I say, why? It's a crap picture. You know, there's nothing I can do about it. So sometimes I do listen to my colleagues and say, "We want AI now." I say, "For what?" And then, how do you know that the result that you have is what you're gonna? Is it really going to solve your problem? I very much doubt that with the data that we have in our systems, sometimes we can actually get intelligence advice from artificial intelligence, right? So it's a long way. I think that what's happening is that it's very new. It's very fast, and everybody is jumping into it. So as a CIO, probably you get about 50 automated emails a day from a company that has a vegetable or a plant, like in my country is pineapple technology or mango technology, or sometimes they have an ape, like chimp technology. They have a platform, they have an API, and they have an algorithm. Those are the equivalents of the Photoshop and the grab picture. I don't know what the platform does. I don't know what the algorithm do for me. And I don't know what the API can do for me, right? But everybody comes to me and says, we want this. We want this solution implemented. So what are you trying to solve with it? It's like, I don't know. I like it, right? So this is going to happen more and more. You're talking about governance from the government. Well, I don't know if I want that, actually. I don't know if we have knowledge enough from the government to tell us what to do with AI, because we haven't got through the process of utilizing it in the real use cases in test environments, by the way, right? But I can tell you, for example, that I'm very frustrated when we talk in this conference and we say, what is the future? What are you looking forward to? We always mention precision medicine, for example, right? Precision medicine, data analytics, interoperability are our really biggest challenges. Well, if you realize now the public is very concerned about consent, for example, it's my data. Well, not everything is the public's data, right? But if you look at data transformation using AI, for example, you come into processing it and you have to anonymize it. Well, the tools that we have or the mandates that we have for anonymizing data were done in the 90s. If you look at HIPAA in the US, for example, right? So I think that we need new formulas so I can implement this AI in a way that I'm not challenged, because I cannot anonymize data because it's a process. So I need consent from the patient, right? So if I have the government telling me the regulation, it's already happening, right? I say, yeah, it's a process. You need consent from the patient. Then I'm paralyzed, right? So I do see, and we do implement AI in the hospital already, and the doctors are very happy to adopt it, particularly in imaging, right? And it's proven, and it's got FDA approval, and it's safe to use, right? And it's used safely as well. In the other areas, I would add with cautions, because you need to test this very well until you are very sure that it can actually add value to that doctor and not create a bigger problem, right? So I do err on the cautious side.
Yeah, absolutely. I think you're going to have a lot of particularly clinical stakeholders who would be a little bit demanding around, AI. We want it now. We want it integrated to track, but
we want to do a POC. What do you want to POC?
We have to bear in mind that it's not as well tested as we want it to be. There could be some patient safety implications. Guys, it's been an absolutely fascinating discussion. I think we went off script a little tiny bit, but I think we'll end there. Thank you very much for coming to the panel.
Thank you. Pleasure, everybody.
Very interesting. Thank you.
Thank you so much.